Welcome, everybody, to From Lab to Market, a showcase of research impact through commercialization.
Thank you, Matthew, for that really generous introduction. And also I want to thank you for all the support that you've given the partnership between the university and Kinoxis that I'm here to tell everyone a little bit about this evening. So Kinoxis Therapeutics is a private, Australian-based, we're really proud to say now, clinical stage biotechnology company. And it was founded to provide a pathway to impact for novel therapeutics that were, or potential therapeutics that were discovered here at the University of Sydney, including a small molecule, KNX100, that was showing potential for treating a range of different substance use disorders, as well as earlier stage novel chemistry targeting the oxytocin receptor that could lead to new treatments for a range of different psychiatric indications. Since founding Kinoxis Therapeutics back in 2018, we've taken the lead compound from being a very early stage preclinical compound through the valley of death and into first-in-human clinical trials. To support this R&D program, we've raised over $15.5 million from investors cornerstoned by the university-backed venture fund Uniseed. We've established a major partnership with the US National Institutes of Health to develop our lead compound, KNX100, for the treatment of opioid use disorder to help tackle the devastating opioid crisis. And this partnership with the NIH has provided over $10 million in non-dilutive funding through highly competitive NIH grant schemes. In addition to our KNX100 program, we've recently entered into a co-development partnership with Boehringer Ingelheim, one of the world's largest pharmaceutical companies. And that partnership is focused on developing oxytocin receptor targeting transdiagnostic therapeutics for social dysfunction in psychiatric disorders. So for the rest of my presentation, I'm actually going to focus on talking about a few of the key benefits that the university gets from partnerships like the one it has with Kinoxis Therapeutics and from spin-out companies like Kinoxis Therapeutics. And I'll provide some examples from the alliance with Kinoxis. So firstly, spin-out companies like Kinoxis really are vehicles for commercialization of the world-class research that's going on here at this institution. Kinoxis is commercializing over 90 patents that cover discoveries made here at this university. And the recent deal with Boehringer Ingelheim is worth up to in excess of $250 million. And we're going to be looking to do another, potentially even larger deal on the KNX100 program once we complete our phase 2 clinical program. Now, as the second largest shareholder in Kinoxis Therapeutics, the University of Sydney stands to gain considerably from the commercial successes of Kinoxis. Secondly, strong partnerships like the one the university has with Kinoxis are great facilitators of research and discovery at this university. To date, Kinoxis has funded over $9 million of research at the university, and this spans multiple schools, faculties, MDIs, and core research facilities. It funds students, researchers, research costs, and major equipment purchases. This has not only turbocharged the development of the initial core technology that was licensed by Kinoxis from the university back in 2018, but it's actually funded research that has led to new discoveries and intellectual property coming out of my lab in the School of Psychology and at the Brain and Mind Centre, and out of Professor Michael Cassio's lab in the School of Chemistry. The recently launched partnership with Boehringer Ingelheim is only going to further expand the support for research at the university, funding 11 full-time researchers at the university and all research costs for the oxytocin program. Now, spin-out companies like Kinoxis, I truly believe, are really going to be key to delivering on many of the aspirations of the 2032 strategy. These aspirations describe a university where people take risks and innovate, where there is a research pipeline all the way from blue sky discoveries right through to research translation and application, where engagement and impact are part of all research programs. It describes a university that is the partner of choice for industry and governments, that is committed to commercialisation, and that has an environment that sets higher degree and early career researchers up for their career, be it in industry, the public sector, or academia. The University Kinoxis partnership is already helping to realise these aspirations. We've translated blue sky research into the clinic in areas of major societal need, and we've done this by commercialising university discoveries. We've done this through forming major partnerships with industry and government and leading a truly multidisciplinary research program that spans nearly a dozen different countries. We've created industry PhD scholarships and internship programs that allow our higher degree and early career researchers to have meaningful, deep involvement in multidisciplinary industry-partnered research programs. And it's worth noting that several of these students and researchers are now working directly for Kinoxis, opening a doorway into a career in industry. Lastly, and most importantly, spin-outs like Kinoxis provide a pathway to real-world impact for the important research that's being conducted at this university. Opioid overdose has become the #1 cause of death amongst people aged 18 to 45 in the United States. It kills more Australians each year than car accidents. When we launched the first in-human clinical trial with the Kinoxis lead compound KNX100 in April last year, it became the only novel compound in clinical development for the treatment of opioid use disorder globally. It's currently still one of only 4. Now, to put that into perspective, there are over 3,000 novel compounds in clinical development for the treatment of cancer. Over the next 2 years, we're going to be launching 3 phase 2 clinical programs for KNX100 spanning substance use disorders through to the treatment of agitation and aggression in dementia. These are all areas with enormous unmet need and very little in the clinical development pipeline. These are exactly the sorts of areas that we should be targeting with academic industry partnerships. So to wrap up, I really want to emphasise how critical the support from every level of this university has been to the success of Kinoxis Therapeutics and the alliance between the university and Kinoxis. From heads of schools and the co-directors of the Brain and Mind Centre, through to deans, pro-vice-chancellors, right through to the Deputy Vice-Chancellor of Research, the Vice-Chancellor and the Chancellor. So to all of the leaders in the audience today, please encourage researchers, especially higher degree and early career researchers, to be daring, to take risks, to innovate, and to dream big and venture beyond traditional academia when thinking about how their research might have impact. And when they do this, let's make sure that we recognise it, we celebrate it, and we reward it, so that our future leaders see pursuing partnerships like the University Kinoxis Alliance not only as a pathway to impact, but as a genuine career path. Thank you.